Do not go outside for activities. Do not use a sit-stand workstation. And do not go out for a walk until you learn these 3 important factors about your body. Stay tuned for Monday Moves with Marian. Hey there, it's Marian Barnick. I'm so happy that you are with me today, and we are talking about standing postures. If you don't have that proper standing posture, then you're going to be looking at long-term, not just those aches and pains that may creep in, but actual damage to your joints, actual damage to your ankles, your knees, and your hips. And you're also looking at the compensations that are going to happen, whether we are thinking about getting a sit-stand workstation in the office, whether or not we are trying to rehabilitate after surgery or after an injury and we are going out to get our body back in shape with walking, or if you're an athlete and you are playing golf, playing tennis, if you haven't set that proper position for your biomechanics, for your body alignment, then all of the rest of your body is going to have to compensate to help you out. So let's get it right in the first place, okay? So there's 2 planes that I really want you to look at when we're looking at the body alignment in a standing position. So we're going to look at the coronal plane and we're going to look at the sagittal plane. These are 2 planes that divide the body in half, one from right and left and one from front and back. And those are the 2 that I want to focus on today. What I want to see with my patients when they come to see me or we're doing an online evaluation is taking a look at how balanced the body is from the front to the back. So we want to see if there's any sway, if there's any lean, or if we've got a nice neutral posture.
When we take a look at this woman here, we can see that the standing posture, if we don't draw the line, looks not too bad. She looks pretty upright. But when we look on the right-hand side and I draw the line in to look at where the alignment actually is, you can see if we have the ear over the shoulder and the shoulder over the hip, that line is not a straight line. It's definitely angled and it is not perpendicular to the floor. That's showing us that we've got that sway in the body. We don't have that alignment that we are absolutely looking for.
So there's a couple things that you really want to be aware of when we're looking at the balance between the front and the back of the body. First of all, we want to look at how tight those muscles are. If you can't get yourself into alignment that way, there may be some tightness that is causing the issues. And what you're going to see when you go out for your activities or you're standing in the office or you are active on the tennis court is you're going to see that certain muscles are going to have to work harder, which means they're going to get weaker, they're going to get sore, and they're going to compensate. So you certainly won't be at your best potential when you have the imbalance between the front and the back of your body.
When we take a look at this young man, we're looking at his posture and it doesn't seem to be too bad. And we're looking at the front and the back of the body. So if we take this to the next slide, drawing in the line definitely helps us see where we've got the body alignment issues comparing the front to the back. We'd like to see the ear to the shoulder. We see that and it doesn't look too bad here. But as we get into the lower body, as we look at the hips and we look further down where we'd like to see that alignment coming to the outside ankle to the lateral malleolus, we see this guy's got some issues here. We definitely see that that line is anterior to or in front of that lower leg. And 2 of the areas that I will definitely like to check when we look at doing our biomechanical analysis is looking at the core, looking at the abdominal muscles and looking to see about the stabilizers in this area. I also want to look at the ankle. I want to look at the range of motion in this area to see if we've got any tightness that is throwing off our body alignment.
Now the other thing we want to look at when we're looking at those planes and those balances is between the right and the left sides. So I want you to take a look at how balanced you are, and you can check from the shoulders to see if your shoulders are in alignment.
When we're completing our body alignment review in the sagittal plane, one of the first places we can check is looking at the shoulder alignment. And when we look at this lady and we've drawn our line across, and again, this is going to be parallel to the floor, we're comparing the left and the right sides, we can see that there are some issues with the shoulder. That right shoulder is definitely elevated above the left. Now, if we got into looking at the rotation rotation in the body as well, we could definitely see some issues, and we will cover that in another Monday Moves. But I want you to take a look and see that that right shoulder is higher, and that can definitely throw off the posture in other areas of the body and cause some compensations, as we can see with the position of her neck as well.
But I want you to look beyond the shoulders, and I want you to look at your hips. So I want you to press your thumbs in, and I want you to feel the tops of your pelvis bone. I want you to feel to the ASIS, and you should be able to palpate that and see in the mirror if those are aligned.
So the anterior superior iliac spine, big long word, I say ASIS, it makes it a lot easier. It's where you're going to palpate. That's where you're going to put your fingers, and you're going to check for the pelvis alignment. Now, sometimes we call this hips, it is the pelvis, but that's going to give you a good idea at the midline of where your hips are and if they're aligned on the right and left sides.
If they're not, I want to see if you can balance those. See if by switching your position, if moving those hips up and down, you can see if the control of the muscles is actually the cause of any tightness or any restriction within your hips that's causing an imbalance between your right and your left sides. Then go down one stage and see if your knees are aligned. I'd really like you to look at that in the standing position. That's going to give you the information on your right and left to see if they're in alignment. So we've talked a lot about ear to the shoulder and shoulder to the hips, especially for my office biomechanics clients. But I want you to see that in standing as well, especially if you're looking to implement a sit-stand workstation, or if you are implementing a walking program now in North America where certain parts are getting a little warmer. You may be out walking, tennis courts are opening up, you may be outside doing more of those activities where you've got more of a flow to your body and you're less restricted. That's where the importance of that body alignment is really going to come into play.
It's not just with standing that I want your posture to be in alignment. I want you to be in alignment when you're out walking as well. And this is certainly something that's important if you are starting walking as part of your rehabilitation program, getting back into shape after surgery or after an injury. And I want that posture to be like the picture on the left in the green. Nice and aligned. We can see ears, shoulders, and hips. We can see the strides aren't causing a change in the body alignment as we're moving. If you look at the position in the middle, that can definitely be some of us. When we are excited to get outside and we are pushing forward, we may be changing our posture by jetting out the head, thinking we are pushing forward, but it is taking your body out of alignment, and it's definitely going to cause some issues with how you're moving. Same goes for the picture on the far right side. This is not the posture I want to see with my clients. This is a posture where you are actually extending in the back as you are walking. So you are changing your alignment in the lumbar spine. We don't want to see that. We want to see stability in this area. We want to see that you can keep a nice lumbar curve, but not that it's extending as you are walking.
Play, because these are automated movements, because it's something that we don't think about as we move, as we walk, as you swing the tennis racket. Even when we're sitting, we don't think about that alignment a lot. We want it to be automated, but we want it to be automated in the right way. So that's where I want you to look at the ear and the shoulder and the shoulders and the hips. And I want you to see if there's any sway. I want you to also see if those knees tend to maybe sway forward a little bit or backwards a little bit to try and compensate, especially with those hips. If you've got tightness in those hip flexors, if your hamstrings are super tight, and guys, I am talking to you about those hamstrings, then you may see a sway in that posture where those shoulders may be back farther to try and compensate.
Now guys, I am talking to you here, although this does happen with women as well. I do see more of my male patients having this issue. We're taking a look at this line. We're going down from the ear down to the ankle and looking at this body alignment review. But what we're seeing here is that that hip position is in front of our neutral line when we're looking at the alignment from the front to the rear of the body. The first thing I want to show you is taking a look at the alignment of the pelvis. If we look at that hip area and we draw a line across that should be parallel with the floor, we can definitely see that we've got an angle here on the pelvis. And this is a telltale marker of an issue with our body alignment. Once we complete a full biomechanical analysis, we'll definitely make sure of what's going on with this gentleman's posture. But the body alignment review is giving us some information here already that we've got some pelvic issues, we've got a body alignment problem, we've got the pelvis that is definitely showing a position that is related most likely to some tightness in the hamstrings. Now, of course, we don't know what's coming first, but we do know with this position, with tightness in the hamstrings, we've got a potential for injury, and we certainly have issues with pain, with tightness, and with performance.
These are the things that are going to end up costing you, not only with performance, but with injuries as well. What I would like you to do, if you're having problems with this, if you're not sure how your alignment is matching up either right, left, or front, back, and the front, back may be a little harder for you to test, then I want you to snap a picture and I want you to send it to me. I want to take a look at your alignment, and I want to know it's okay to use it in an upcoming live, because then I'll be able to give you specific advice for exactly how I see your alignment, and you'll be able to get some of those pro tips that are going to help you in the future with all of your activities. It's going to decrease your pain, it's going to increase your performance, and you're going to feel better. I hope you have an awesome day. This is Marion with Monday Moves. Take care.